presentations on Saturday were focused on trying to use telehealth to deliver eye care to the emergency room and the urgent care clinics, because that's where a lot of patients present when they have an acute eye problem. And so my team and I have been working on this. It's an interest of ours because there's so much difficulty with access in that scenario. And so some of our key takeaways was presenting the data that's been done by different teams. And I think it's very clear that a fundus camera in the emergency room is very helpful. And then the second key takeaway is that a slit lamp exam is also helpful, but we need a little more work in terms of looking at the accuracy of that equipment and what kind of equipment we could use to help the doctor make an accurate diagnosis using telehealth. If you think of it as a diagnostic accuracy, trying to see if it's more, if the telehealth exam using the telehealth equipment is as accurate as if you saw the eye doctor, like if the eye doctor came into the emergency room for you, because obviously it's not safe if it's not accurate compared to, a traditional, exam. So we've been looking at that as part of the development of this program. I think that with the aging population and the shortage of eye providers, both ophthalmology and optometry, that telehealth is going to be one of the ways that our specialty is going to be able to help people who truly need our help get the care that they need. So I think that especially with regards to ophthalmology, many subspecialists are highly concentrated in the urban areas. And so there's a wide swath of patients that can't get the care they need, and they're going to suffer a lot of vision loss as a result. And so telehealth is going to be one way for us to reach those patients and really bring that, be able to bring our expertise to them, and they need it so that we can make sure that they, continue to be able to see. And so the idea is that I think that the gap of healthcare inequity and disparity is going to grow, and telehealth is a tool to combat that, and also to, just how vision is such an important part of people's lives, like just to make sure people don't go blind. Just kind of want to be clear about that. It depends a little bit on the definition of exam. So, when you are a patient, the number one reason people have blurry vision most of the time is because they just need glasses or contacts. And if they're young and healthy and don't have other medical problems like diabetes or high blood pressure, oftentimes it may be safe, depending on, a variety of factors, for them to have a online based prescription to check what power they need for their glasses and their contacts. And so I think that there are some really good and accurate software being developed by different companies, including Warby Parker, to kind of evaluate that. I think the really key important part there is to know that that is not the same, and nor is it ever intended to replace an ocular health exam, which is very different and much more challenging at this point with the way the technology is to determine your ocular health online. Because in order to, check ocular health, for example, somebody needs to take a look at the back of your eye, the retina. Well, it's really hard for you to do that online. You can't just look into a, phone camera and take a picture of the retina. Usually you need to be dilated, or you need someone to take that photo for you. So I think that's where other telehealth programs, come into play. So in this particular case, we were looking at finding ways to accurately identify, are your glasses prescriptions you're wearing, your contact lens prescription you're wearing, is it accurate and can it be renewed? But it's not a ocular health exam, and that's important to know the difference. And I think that patients need both. So, they need both. They may need it at different intervals, but patients do need both to ensure that their eyes are very healthy. And if they have other medical problems, an ocular health exam should be prioritized. Like if you have diabetes, for example, you need an ocular health exam, which can include, eyeglass prescriptions.